Welcome to Vet Fraternity. In this video, we are going to talk about lens luxation. Lens luxation, basically, it's a complete dislocation of lens anteriorly into the anterior chamber or posteriorly into posterior chamber from its normal position, occurs as a result of abnormal development or degeneration or ruptures of lens zonules. So basically what they are talking about that the lens can luxate anteriorly or posteriorly. I'll show you the diagram and you will understand it better. From its normal position. So if this is the eye and this is the lens, it can dislocate anteriorly or it can dislocate posteriorly. And why this happens? Because of the abnormal development or degeneration or ruptures of lens zonules. Basically, it is the zonules that hold the lens at its place. Either there is abnormal development or their degeneration or their rupture that causes lens to luxate anteriorly or posteriorly. As far as signalement is concerned, all species can have this disease, but it is common in as a primary inherited defect associated with ADAMTS17 mutation in terrier breeds. So, as far as the history is concerned, what the owner is going to give you, what they are going to mention in the exam question, that the dog has been presented with the signs of ocular pain in case of anterior lens luxation, including tearing, redness, squinting, or blepharospasm. There might be cloudy cornea due to edema secondary to corneal endothelial damage, or there is increased intraocular pressure, or there will be the history of vision changes. These pictures are very important as far as exam question is concerned, because in the topic of lens luxation, they are going to be more focused on the image. So this is the complete anterior lens luxation. You can see this is the lens that has been luxated, because it should have been at the center at this place, but this has like fallen, and this is lens subluxation. Only a half portion of the lens has been luxated. So from here, it has luxated to this much of the distance. Well, physical exam, the signs are there are not going to be any signs systematically. It's not a systematic disease. Only ophthalmic exam will be needed, and the eye is going to have the issues. Abnormal anterior chamber depth, shallow with anterior luxation or deep with the posterior luxation, because the anterior chamber depth is going to be affected by the lens luxation. If the lens is going to be in the anterior chamber, it is going to have shallow, or like you can say small depth. But if the lens has been luxated on the back side, then there is a depth to that. These words iridodonesis or phacodonesis, these are not much important as far as paper is concerned. They're not going to give you like much hard wordings, but I have mentioned it over here because you should know these, that iridodonesis is trembling of iris or trembling of lens is called phacodonesis. Then a phakic crescent shaped gap in between people where lens is missing. You can see this crescent. So this is a portion where lens is missing. So this crescent is being formed. It's not important like in the terminology wise, but you should know how to see this in this image, because for this topic, the like image is more important. They are definitely going to give you image. Then there is mild corneal edema. Complete displacement into anterior chamber produces acute signs and frequently accompanied by glaucoma and corneal edema. So they might give you a history of like lens luxated animal with the image of it, and they might ask you that the squala or the diseases that are frequently accompanied to the lens luxation. So you should know it can be glaucoma or it can be corneal edema. Well, as far as posterior displacement into vitreous cavity, it is going to be asymptomatic or associated with ocular inflammation or glaucoma. So if there is luxation and with acute signs, it's anterior, and if there is luxation with asymptomatic no signs, it's going to be posterior displacement. Okay, you can see this image. This is like a lens, and these are the structures or zonules or the things that have basically held the lens at its place. So this is a normal one. Only one side, from one side, the lens zonules are being broken. So it is a subluxated lens. But if you see this image, this is posterior luxation, that the lens has been displaced posteriorly. And this is anterior luxation. The lens has displaced to anterior side. Well, for diagnosis, it's just physical exam, complete ophthalmic exam. You have to perform no specific tests. Well, treatment acute anterior lens luxation is an emergency situation. You should know that. And for that, you have to do prompt referral of the acute lens luxation to veterinary ophthalmologist for surgical lens removal. So basically, the surgery or the treatment of choice is intracapsular lens luxation or phacoemulsification. But you are not going to perform this on your own. You are going to do the referral. So if they are going to give you the options, they give you a statement of lens luxation, and then they ask you for the like your next step in such case. And in one option they give you referral to ophthalmologist. So in the second option they give you intracapsular lens extraction and phacoemulsification. You are not going to pick the intracapsular lens extraction or phacoemulsification. You are going to go for referral. So always pick as per uh, the options, the all options they have given you. So here the right answer is going to be the referral one. No doubt these surgeries are the treatment of choice or the surgeries of choice that should be performed in this case. But you are not going to do that. You are going to refer it to the veterinary ophthalmologist who is the who is the right guy to perform this surgery, and he will do that. If referral is not possible, then lens luxated anteriorly, consider pupil dilation and IV mannitol to shrink vitreous and shift lens to vitreous. Then lifelong topical meiotic prostaglandin to trap lens in the vitreous. So basically, this is what you are going to do if referral is not possible. That you are going to dilate the pupil, and you just are going to use IV mannitol to shrink the vitreous and shift lens to the vitreous. And you have to use these meiotics for the lifelong. If the posterior lens luxation, topical meiotic can restrict the lens movement. Consider referral, because even if you are doing the medical therapy, that medical therapy alone is not going to prevent glaucoma or luxation associated vision loss. So I have already discussed that the glaucoma, it is going to accompany this disease, and which will later on lead to vision loss. So if you want to stop that vision loss, try to do the referral, and so that the eye can be saved for the vision loss. Well, prognosis, early surgical intervention by phacoemulsification while lens is subluxated increases the success rate. Most common complications are glaucoma and retinal detachment. So that was all about lens luxation. I hope you enjoyed the lecture. Thank you.